Okay, so you guys have sent us a ton of stuff on opioid detox.
Yeah.
It seems like you really want to get into the nitty-gritty of this,
Mm,
and rightfully so, it's a really important topic.
it is.
So think of this as a deep dive on opioid detox. We're going to break down what it is, what you can expect during that process, and why that careful, medically supervised tapering is so crucial.
It's about giving you the tools and the knowledge
Hmm.
to really navigate this complex landscape.
Exactly.
Yeah.
So first things first, we hear the term opioid detox thrown around a lot.
Right.
But what does that actually mean?
It's really more than just getting opioids out of your system.
Right.
It's about managing those often really intense withdrawal symptoms.
Yeah.
So you can actually begin your journey, towards recovery.
Because those withdrawal symptoms can be so bad that it drives people right back to using, right?
Oh, absolutely. It's like,
yeah.
it's one of the more crucial pieces here because, if you can't get past that initial hump,
Right.
it can be incredibly difficult to even begin to address the underlying issue.
Yeah, it's like you can't even get to the starting line if
Yeah.
you're constantly battling those intense physical and mental cravings.
That's why detox is so important, right?
Yeah.
It's about safely, effectively managing those symptoms so that recovery is even,
Possible.
possible. Exactly.
That's like the essential first step.
Absolutely.
Okay, so let's talk about what to expect during that initial detox phase.
Okay.
Because you've shared some sources with us that lay out a pretty detailed timeline of
Yeah.
what someone might go through.
And it's important to remember
Yeah.
that everyone's experience, of course, is going to be different.
Right.
But there are definitely some common threads
Okay.
that we see. And, those first few days, especially like days 1, 3,
Oh, yeah.
that tends to be the most intense.
I bet, yeah, the sources mention things like anxiety,
Oh, yeah.
nausea, muscle aches. It doesn't sound pleasant.
It can be really rough.
Yeah.
I mean, imagine the worst flu you've ever had, and then like times 10.
Oh, wow.
You're talking chills, sweating, insomnia.
Yeah.
I mean, you name it, it's probably on the list.
And that's why medical supervision during this phase is so important.
Absolutely non-negotiable.
Yeah.
I mean, this is not something you want to try to tough out on your own.
So what can be done to help manage those symptoms? Because, obviously you just said it can be incredibly intense.
It is.
Our sources mentioned medications.
Yes, medications play a really crucial role here.
Okay.
Because they can help to manage those really acute withdrawal symptoms.
Yeah.
For example, something like clonidine can be really helpful for anxiety, muscle aches.
Okay.
Antiemetics can help combat nausea and vomiting, things like that.
So it's about making those first few days as bearable as possible so you can get through them.
Exactly. You want to reduce the severity of those symptoms
Right.
to a manageable level.
Got it.
Now, around days 4, 7, things typically start to ease up a bit.
Okay.
The body's starting to adjust.
Mm-hmm.
But some of those symptoms might stick around.
Right. Is that where medications like buprenorphine or methadone might come in?
Yeah, that's right.
Because I know those are often used in what's called medication-assisted treatment, or MAT.
Exactly. And buprenorphine, for example, it works by binding to those same receptors in the brain
Okay.
as opioids do. But it does it in a way that reduces cravings and those withdrawal symptoms.
Okay, so it's sort of like tricking the brain.
In a way, yeah.
Wow, that's interesting.
Yeah.
So it sounds like then weeks 2 to 4 and beyond, that's when the focus shifts more from managing those acute symptoms to really starting to address those root causes of the addiction, right?
Yeah, that's exactly right.
Because you've kind of gotten over that initial
hump.
that initial hurdle.
Exactly.
So now it's like, okay, let's really dig into
What's going on?
the why. What's going on here?
This phase is all about tapering that opioid dosage
Right.
safely and effectively.
Mhm.
But at the same time, simultaneously addressing those underlying psychological
Yeah.
and emotional factors.
Right, so it's like a two-pronged approach.
Absolutely.
You're addressing the physical
Mhm.
and the mental and emotional at the same time.
Exactly.
So what does that look like in practice?
Well, we're talking therapy.
Okay.
Often cognitive behavioral therapy, or CBT,
Okay.
support groups, building a strong support network. It's really about building that solid foundation
Yeah.
for long-term recovery.
So we've got this timeline, we've got these different phases.
Right.
But it's important to acknowledge that detox, it's not exactly a walk in the park, is it?
No, it's definitely challenging, and I think it's important to be upfront about that.
But it's also incredibly possible, and it's important to keep that in mind, too.
Yeah.
It can be done.
Yeah. And I think that's what we really want to emphasize here is that
Absolutely.
this is a process that can be incredibly challenging,
Mm-hmm.
but it is absolutely possible to come out
Absolutely.
on the other side.
On the other side.
So let's talk about some of those challenges
Okay. Yeah.
because our sources highlighted both physical and mental hurdles that people can encounter during this process.
Yeah. Yeah.
And I think it's important for us to really
Break them down.
break those down so that people understand what they might be getting themselves into
Absolutely.
or what they might experience should they choose to embark on this journey.
Right. Exactly. And I think, knowledge is power in this situation.
The more you understand what to expect, the better prepared you'll be
Absolutely.
to navigate those challenges when they arise. Because, let's be real, they will arise.
They will arise.
Right. So, let's be real about that.
They will.
It's not going to be easy,
No.
but it is doable.
It is doable. That's what we want to stress.
Absolutely.
Okay. So let's dig into some of those challenges.
Okay.
I think, first and foremost, we have to address the elephant in the room,
Right. Yeah.
which is those physical symptoms.
Oh, yeah.
Because detox, it's not just a mental and emotional process. It's incredibly physical.
Absolutely.
And the sources we've got here, they paint a pretty vivid picture of what that physical experience can be like.
We do.
And it's not always pretty.
No, it's not.
Yeah.
It's not pretty at all.
So let's talk about some of those physical symptoms that people might experience.
Okay.
Because I think, again, having that knowledge beforehand can be really empowering
Yeah. Absolutely.
so that you're not caught off guard.
Right.
You're like, oh my gosh, what's happening to me?
Exactly. Exactly.
So let's break it down.
Okay.
What are some of those physical things that people might experience?
Well, I mean, you're talking about muscle aches, cramps, even diarrhea.
Oh, wow.
It's really your body in revolt,
Yeah.
right? I mean, you're essentially forcing it to go through a pretty dramatic shift,
Yeah.
and it's going to fight back, and that's why that medical support is so crucial.
Yeah, because you're right. It's like it's
Yeah.
not just a matter of willpower at this point. This
No.
is your body physically going through
Right.
physiological.
Yeah, physiological
Yeah,
withdrawal.
absolutely.
And so having those medical professionals there to help manage those symptoms safely
Yes.
and effectively, not to just like, oh, just tough it out, you'll be fine.
Right, because that can be incredibly dangerous, right?
Yeah, that can be really dangerous.
I mean, in some cases, even life-threatening.
Right.
So it's not something to take lightly.
Absolutely not.
And it's really important to stress that if you're considering detox,
Yeah,
please talk to a medical professional.
Yeah, don't try to do this on your own.
Don't do this on your own.
It's not safe.
Not safe at all.
And it can be really dangerous.
Mhm.
So we've talked about the physical symptoms.
Yeah. But we can't forget about the mental and emotional toll that detox takes as well.
Absolutely, yeah.
Because it's not just your body that's going through it.
Right.
It's your mind.
Your mind.
And it's your emotions as well.
Exactly.
And those can be just as intense, if not more so,
Oh, absolutely.
than those physical symptoms.
And they can be really debilitating in their own right.
Right. And they often get overlooked
They do. They do.
because people are so focused on oh, I'm not physically dependent anymore.
Right.
But they don't realize that there's this whole other layer
Exactly.
of the detox process.
It's not just a physical process.
Yeah.
It's a whole person process.
It is.
Right.
It is.
It's mind, body, and spirit, really.
Yeah.
And all of those aspects need to be addressed.
So what are some of those psychological and emotional challenges that people might experience?
Well, you're talking about anxiety, insomnia, agitation.
Yeah.
These are all incredibly common.
Okay.
And they can really, make it difficult to focus on anything else.
Right.
It's hard to focus on your recovery when you're just completely overwhelmed by anxiety or you can't sleep at night.
Right. You're not thinking clearly.
Exactly.
Well,
You're
it's like,
exhausted.
Exhausted.
You're not in a good place.
Right. And those things can lead to relapse as well.
Oh, absolutely.
So it's
Yeah.
important to address those.
They're just as important as those physical symptoms,
Mm.
and they deserve just as much attention.
Yeah. And I think that's what we really want to drive home here is that it's about treating the whole person, not just the addiction.
A whole person, yeah.
Because you can't separate those things.
You can't.
Your mental health, your emotional health, your physical health,
They're all intertwined.
they're all completely intertwined. And so.
You can't treat one without addressing the others.
Exactly.
And that's really the key to successful recovery.
And then there's I don't want to say it's the biggest challenge because it's all challenging,
Right.
but then there's the challenge of relapse.
Yeah, that's the big one. Right.
because you can get through.
You can do everything
You
right.
can do everything right.
Right.
You can manage those physical symptoms. You can address those mental and emotional hurdles.
Mm,
But then there's that pull
that cool.
of those cravings.
Yeah.
And that can be so powerful.
It can be incredibly powerful, especially when you're already feeling so vulnerable,
Right.
right? You're
Yeah.
physically uncomfortable, you're emotionally drained,
Mm-hmm.
and then those cravings hit.
Yeah.
And it's so easy to think, oh, just one time won't hurt.
Right. Just to take the edge off.
Exactly.
Yeah.
Exactly. Just to feel better. But of course, we know
Right.
that one time often leads to another, and then before you know it, you're right back where you started.
Yeah. That's a slippery slope.
It is a very slippery slope, and that's why understanding the risk of relapse and having those strategies in place
Yeah.
are so, so crucial.
So let's talk about relapse for a second, because
Okay.
it's something that we definitely want to make sure that our listeners understand.
Absolutely.
Because again, it can feel like this insurmountable thing. It can feel like, oh, well, if I'm destined to relapse anyway, why even bother?
Right, right. But that's not true at all.
Right, exactly. And that's what we want to make sure people understand.
Yeah.
So what is it about relapse that makes it so difficult to overcome?
Well, I think a big part of it is that it's often triggered by things that we don't even realize are triggers.
Okay, so like what? Give me an example.
Sure. So it could be something as simple as driving past a place where you used to use,
Oh, wow.
or seeing someone you used to use with.
Okay.
It could be a certain smell, a certain sound, even a certain time of day.
Oh, wow. I never even thought about that.
Yeah, it's amazing how our brains create these associations
Yeah.
and how powerful those associations can be.
So it's like your brain has been wired
Wired, yeah,
to associate certain things with using.
exactly.
And so when you encounter those things again,
It's like a reflex.
it triggers that craving.
Exactly, it triggers that craving, and it can be really hard to resist.
So what can people do?
Okay.
Because we've talked about those triggers,
Mm-hmm.
but how can people, how can they prepare for that?
Well, I think the first step is awareness.
Right.
Just being aware of what your triggers are.
Okay.
And that might take some time and some reflection to really identify.
Right.
But once you know what your triggers are, you can start to develop strategies for coping with them.
Okay. So it's like having a plan.
It's like having a plan.
Okay.
Exactly. So if you know that driving past a certain place is a trigger for you, maybe you start taking a different route. If seeing a certain person is a trigger, maybe you limit your contact with that person.
Okay. So it's about,
making changes
making changes in your life
in your environment
to avoid
to avoid those triggers.
those potential pitfalls.
Exactly. Exactly.
But what about when you can't avoid them?
Right.
Because let's be real,
Yeah, you can't avoid everything.
you can't avoid everything.
Right. So you also need to have strategies for coping with those cravings when they do hit.
Okay. So what are some strategies that people can use?
Well, one thing that could be really helpful is to have a support system in place.
Okay.
So that could be friends, family members, a therapist, a support group,
Mm-hmm.
people who you can reach out to when you're struggling.
Okay. So you're not going through it alone.
You're not going through it alone. And that can make a world of difference.
Yeah. It makes you feel less isolated.
Exactly. Exactly. Because isolation is one of the biggest risk factors for relapse.
That makes sense.
So, having those people that you can reach out to who can offer support, who can offer encouragement,
Yeah.
that's huge.
Huge. Okay.
And then, in addition to having that support system,
Mm-hmm.
there are also a lot of different coping mechanisms that people find helpful.
Okay.
Things like mindfulness exercises, deep
Mhm.
breathing exercises,
Mhm.
meditation,
Okay.
journaling.
So these are all things that can help.
Yeah, they can help to kind of manage those cravings, those urges,
Right.
and kind of bring you back to the present moment.
Right. Because it's easy to get caught up in those thoughts
Exactly.
of like, oh, I just want to feel better. Or,
Right, right. And it's easy to kind of go down that rabbit hole.
right, it's just one time.
Exactly, exactly. But these coping mechanisms can help to kind of pull you back from that.
Ground you.
Ground you, exactly.
Okay. So it's about having
It's about having a toolbox.
a toolbox
Yeah.
of different strategies
Exactly.
that you can pull from.
And it might take some trial and error
Okay.
to figure out what works best for you.
Right. Because everyone's different.
Everyone's different, exactly.
Okay.
But the important thing is to have those tools
Yeah.
and to be willing to use them when you need them.
So we've talked about the physical symptoms.
Right.
We've talked about the mental and emotional challenges, and we've talked about relapse.
Mm-hmm.
But I think it's also important to touch on some of the red flags that people should be aware of
Yeah,
during
absolutely.
detox.
Yeah, because as we've discussed,
Yes.
this can be a really, really intense process.
Right.
And it's really important to be able to recognize the signs
Yeah.
that something more serious might be going on.
Right.
So you can get the help you need right away.
Exactly.
Right. So it's not just about, pushing through
Right.
and tucking it out.
Because sometimes those things that you think are just part of the process
Exactly.
are actually signs of something
That needs immediate medical attention.
more serious.
Yes, exactly.
So what are some of those red flags that people should be on the lookout for?
Well, things like severe dehydration,
Okay.
irregular heartbeat,
Okay.
high fever.
Okay, those are all...
Those are all signs that something more serious could be happening.
Yeah, that's not just like, oh, I'm a little dehydrated.
Exactly. Exactly. We're talking about, potentially life-threatening situations.
Right.
So if you're experiencing any of those symptoms,
Mm-hmm.
please, please, please seek medical attention immediately.
Yeah, don't mess around with that.
Don't mess around with it. No,
Because it's not worth it.
it's not worth it.
So it's really about listening to your body.
Yes.
And if something doesn't feel right,
Trust your gut.
trust your gut. Exactly.
Something doesn't feel right, it's probably not.
Reach out, get help.
Exactly.
It's better to be safe than sorry.
Absolutely.
And I think, all of this really underscores the importance of
Yeah.
that medical supervision that we've been talking about.
Exactly.
Because we're not just talking about,
Right.
some abstract concept here.
This is serious business.
This is serious business.
Right.
We're talking about resetting
Exactly.
your body's relationship.
Your body's relationship with a really powerful substance.
And a powerful substance.
And it takes careful, medically supervised support.
Absolutely.
Right.
So let's talk about that support a little bit more.
Right.
Because, we've mentioned tapering a few times,
Mhm.
and I think that's a good segue into that.
Yeah.
Because tapering is a crucial part of managing those withdrawal symptoms and preventing relapse.
It is, yeah.
So let's break down exactly what tapering is
Okay, yeah.
and why it's so important.
So tapering is essentially the process of gradually reducing your opioid dosage over time. So rather than just stopping cold turkey, which, as we've discussed, can be incredibly dangerous.
Right. Not a good idea.
Not a good idea.
Very dangerous.
Right. You slowly wean yourself off of the drug.
Okay.
And this gives your body time to adjust
Okay.
so that you can minimize those withdrawal symptoms.
So it's about making that transition.
Exactly. It's about making that transition as smooth as possible,
Okay.
both physically and emotionally.
Okay. That makes sense.
Yeah.
So it seems like there's this misconception out there
Okay.
that tapering is like a one-size-fits-all approach,
Right, right.
which is just not true, is it?
Not at all.
No. Because everyone is different.
Everyone is different. Yeah.
Everyone's body chemistry is different.
Absolutely.
Everyone's history with opioids is different.
Exactly. Yeah.
So you can't just say, okay, well, this tapering schedule worked for this person, so it'll work for you.
Right. And I think that's where, working closely with a healthcare provider is so important
Yes.
because they can help create that personalized plan
Okay.
that's tailored to your individual needs.
So what are some of the factors that a healthcare provider might consider?
Okay, well, they'll consider things like how long you've been using opioids,
Okay.
the dosage you've been using, your
Mhm.
overall health, any other medical conditions you might have,
Okay.
your personal preferences.
So it's really about,
It's about taking a holistic view.
yeah, a holistic approach
Right.
and not just treating the addiction in isolation.
Exactly, exactly.
So they take all of that information and then they develop a tapering schedule that's tailored specifically to that individual.
Exactly, and the goal is to...
The goal is to reduce the dosage slowly enough
Right.
to manage those withdrawal symptoms,
Mhm.
but effectively enough to prevent relapse.
Okay, so it's about finding that sweet spot
It is. It's about finding that balance.
between, reducing it too quickly,
Right.
which can send you into those intense withdrawals,
Right. Exactly.
but also not reducing it quickly enough where you're
Okay.
kind of stuck.
Or you're at risk for relapse.
Right.
Exactly. Yeah, it's a delicate balance.
It is a delicate balance, and it's not something
It's not an exact
that
science.
you can just, it's not an exact
It's not
science.
a one-size-fits-all.
So it's really crucial.
To work with those medical professionals who have experience in this area,
Absolutely.
who can help guide you through that process
Who can help guide you through that process.
safely and effectively.
Safely and effectively, yeah.
And I know it can be tempting
It can be.
to try to go it alone.
It can.
I mean, we've all seen the movies, right?
Right.
Where it's like, someone locks themselves in a room,
Yeah, they sweat it out.
they sweat it
They
out,
come out the other side.
and they're magically cured.
Right. Right. But it's not realistic.
But unfortunately, real life is not a Hollywood movie.
It's not a Hollywood movie.
And the sources that you've shared,
Yeah.
they make it crystal clear
They do.
that detoxing without medical supervision is incredibly risky.
It's incredibly risky, and it can be incredibly dangerous.
And we don't want to sugarcoat that at all.
No, not at all.
Because this is serious stuff.
It is serious business.
And we want people to be as safe as possible.
Absolutely.
So why is it so risky?
Well, as we've discussed, the withdrawal symptoms themselves
Yeah.
can be incredibly intense.
Right.
And if you're trying to manage those on your own,
Mm-hmm.
without any medical support,
Yeah.
you're putting yourself at risk for a lot of complications.
So what are some of those potential complications?
Well, we talked about dehydration,
Mm-hmm.
irregular heartbeat, seizures,
Seizures. Wow.
yeah, coma, even death.
This is serious stuff.
It is serious stuff, and that's why it's so important to have that medical supervision.
Because those medical professionals, they're trained.
They're trained to recognize those complications, and they can intervene if necessary.
Right. So they can provide
But keep you safe.
they can provide the necessary
Settle
support
yourself.
and treatment
Medication.
to help manage those symptoms and
Um,
prevent those complications from becoming life-threatening.
Exactly. Yeah.
So it's about giving yourself the best possible chance of success
Absolutely.
and the safest possible
Safest possible way to do it.
environment to do it in.
Exactly.
So you've gone through detox,
Right.
you've done it, you've made it through,
Right.
you've overcome that hurdle,
You've laid that groundwork.
but it's not like the journey ends there.
No, absolutely not.
What happens after?
So it's really important to remember that detox is just the first step,
Okay.
right? It's like,
Yeah.
you've cleared your body of the opioids.
Mm-hmm.
You've managed those initial withdrawal symptoms.
Right.
But the real work begins in aftercare.
Okay, so aftercare is crucial.
Absolutely crucial.
It's not just like, okay, you're done, you're good to go.
Right. It's not like a one and done kind of thing.
Right,
It's
exactly.
a process. It's a
It's
lifelong
a-
journey. Exactly.
So what does that aftercare look like?
Well, it can look different for everyone
Okay,
because, again, everyone's needs are different,
right,
but there are some key components that are typically involved.
okay.
And one of the most important ones is therapy,
Okay, so therapy is a big part of aftercare.
a huge part of aftercare,
Okay.
because therapy provides that space
Yeah,
for you to really start to dig into
okay.
those underlying issues that we've been talking about.
Right, because you've kind of gotten over that initial hurdle
Yeah.
of detox.
Exactly.
But now it's like, okay, let's really get to the root of
Yeah, why?
what's going on here.
What's driving this?
What's driving this behavior?
Exactly.
So what are some of the things that you might talk about in therapy?
Well, you might talk about your history with opioid use.
Okay.
You might talk about your triggers,
Mhm.
things that make you want to use.
Okay.
You might talk about your coping mechanisms, healthy and unhealthy.
Right.
Ways that you've learned to deal with stress, ways that you've learned to deal with difficult emotions.
So it's about developing healthier.
Exactly. It's about developing healthier coping mechanisms
Okay.
so that you don't have to rely on opioids
To numb those feelings.
to numb those feelings.
Exactly. Or to escape those situations.
Okay.
So it's about equipping yourself.
It's about giving yourself the tools
Yeah, giving yourself the tools
to deal with life.
to deal with life on life's terms.
Exactly.
Without needing
Without needing
that crutch.
that crutch, that escape.
Okay, that makes sense.
Yeah.
And are there different types of therapy that are particularly helpful for people in recovery?
Yeah, there are a lot of different types of therapy out there.
Okay.
But some of the ones that are most commonly used in addiction recovery are cognitive behavioral therapy,
Okay.
or CBT, and motivational interviewing,
Okay.
or MI.
Okay. And
Yeah.
what do those focus on?
So CBT really focuses on identifying and changing
Okay.
those negative thought patterns and behaviors
Yep.
that contribute to addiction.
So it's like retraining your brain
In a way, yeah.
to react differently to
Exactly.
that situation.
It's about recognizing
Yeah.
those unhealthy thought patterns
Yeah.
and then learning how to challenge them
Okay.
and replace them with healthier ones.
So it's like you're breaking those old patterns
Yes, yeah.
and building new ones.
Building new ones, exactly.
Okay, that's CBT.
That's CBT.
What about motivational interviewing?
So motivational interviewing is a little bit different.
Okay.
It's really about helping you to find your own motivation to change.
Okay, so it's more about that internal.
It's more about that internal drive.
Drive.
Yeah, because, at the end of the day, you can't force someone to recover.
Right.
They have to want it for themselves.
They have to be ready.
They have to be ready.
Yeah.
And so motivational interviewing is really about helping people to explore
Okay.
their own reasons for wanting to change.
Okay. So it's almost like a therapist guiding you.
It's like a guide.
Yeah, guiding you
Yeah.
to come to those conclusions on your own.
Exactly.
Rather than telling you.
Exactly, because when it comes from you, it's so much more powerful.
Right, because you're invested.
You're invested.
Yeah.
Exactly. You're bought in.
You're bought in.
It's not just something that someone else is telling you to do.
Right, it's your journey.
It's your journey.
And you're in the driver's seat.
You're in the driver's seat. Exactly.
Okay, so we've got therapy.
Right.
We've got CBT. We've got motivational interviewing.
Mm-hmm.
What other support systems are there for people in recovery?
Well, support groups can be incredibly helpful. And these are groups like Narcotics Anonymous or Smart Recovery.
Okay, and what's the value there?
Well, I think the biggest value is that sense of community.
Okay.
When you're in recovery, it could be really easy to feel like you're alone.
Right, like you're the only one going through this.
Exactly. Exactly.
Even though statistically that's not true.
Statistically not true at all.
But it can feel that way.
It can feel very isolating.
Yeah.
And so support groups provide that space
Yeah.
for you to connect with other people
Who get it.
who get it,
Yeah.
who understand what you're going through,
Who've been there.
who've been there, who've walked in your shoes.
And they can offer that support
Exactly.
and that encouragement.
And that encouragement, that hope.
That hope.
That you're not alone.
Yeah.
And that recovery is possible.
Right, because it can be hard to see that sometimes.
It can be really hard to see the light at the end of the tunnel
Yeah, when you're in the thick of it.
when you're in the thick of it.
So having those people around you
Yeah.
who can remind you
Exactly.
that it does get better
It does get better.
can be so powerful.
It's huge.
Yeah.
And it's not just about receiving support, it's also about giving support.
Oh, that's a good point.
Right. Because when you're helping other people,
Mm-hmm.
it gives you a sense of purpose.
Right.
It reminds you of how far you've come.
Yeah, it gives you that perspective.
Exactly.
Exactly. So we've got therapy.
Mm-hmm.
We've got support groups.
Mm-hmm.
Are there any other aspects of aftercare that are important to mention?
Yeah, I think it's really important to mention the importance of healthy lifestyle changes.
Okay, so this is where things like exercise and diet come in.
Exactly.
Because those things, they might seem small or insignificant,
Right.
but they can actually make a big difference.
They can make a huge difference in your overall health and well-being.
Yeah.
And when you're talking about recovery,
Mm,
you really want to be addressing all aspects of your health.
right. It's about that holistic approach.
It's about that holistic approach.
Again.
Exactly. Exactly.
Okay, so what are some of those lifestyle changes that people might want to consider?
Well, regular exercise is huge.
Okay, and why is that so important?
Well, for one thing, it helps to reduce stress.
Okay.
And as we've discussed, stress is a major trigger for relapse.
Right.
So anything you can do to manage your stress levels
yeah.
is going to be helpful in your recovery.
Okay.
Exercise also releases endorphins.
Right, those feel-good chemicals.
Those feel-good chemicals, exactly.
So it's like you're giving your brain a natural high
Exactly.
instead of relying on those external substances.
Exactly. So it's a much healthier way
Yeah.
to cope with those cravings.
To cope.
Yeah.
Okay, so exercise is important.
What about diet?
Diet is also really important.
Okay.
Because what you eat affects how you feel.
Right. You are what you eat, as they say.
Exactly.
So
Exactly.
if you're filling your body with processed foods
Right.
and sugary drinks,
Right. You're not going to feel your best.
right, you're going to feel sluggish.
You're going to feel sluggish. You're not going to have any energy.
You're not going to be able to think clearly.
Right. And all of those things.
All of those things can contribute to relapse.
Exactly. Because you're not setting yourself up for success.
Exactly. You're not giving yourself the best possible chance
Okay.
to stay sober.
So what should people be eating?
Well, it's pretty simple, really.
Okay.
It's about focusing on whole, unprocessed foods.
Okay.
Fruits, vegetables, lean protein, whole grains.
Okay, so like a balanced diet.
A balanced diet, exactly.
Yeah.
Nothing crazy.
Right, you don't have to go on some crazy restrictive diet.
No, not at all.
It's just about making healthier choices.
Making healthier choices, exactly.
Okay, so we've got exercise, we've got diet. Anything else that falls under that umbrella of lifestyle changes?
Yeah, sleep is huge.
Oh, sleep, right?
Sleep is so important.
Because when you're sleep deprived,
Oh my gosh.
you're not thinking clearly.
You're not thinking clearly. You're irritable.
You're emotional.
Emotionally wrecked.
Yes, you're not yourself.
Yeah, you're not your best self.
You're not your best self.
And again,
And that makes you so much more vulnerable to relapse.
right, because you're not thinking rationally.
Exactly, exactly.
So how much sleep should people be aiming for?
Most adults need around 7, 8 hours of sleep per night.
Okay.
So, that's a good starting point.
Okay, so if you're not getting that,
It's definitely something to look at.
definitely something to prioritize.
Prioritize sleep, absolutely.
Okay, so we've got exercise.
Mhm. We've got diet, we've got sleep. Those are all really important foundational pieces of the puzzle
Absolutely.
when it comes to aftercare.
And I think the important thing to remember here is that
Yeah,
it's not about being perfect.
right.
It's about progress, not perfection.
Because you're going to have setbacks.
You're going to have setbacks.
You're going to have days where you don't eat perfectly,
Exactly.
or you don't get enough sleep,
Right.
or you don't exercise,
Right.
and that's okay.
That's okay.
It's about, picking yourself up,
Exactly.
dusting yourself off.
It's not about, if you have a slip up, it doesn't mean you failed.
Right.
It just means you're human.
Exactly.
And it's an opportunity to learn and grow.
Yeah, to learn from that experience and come back stronger.
Exactly. Exactly.
Okay, so we've talked about a lot of different aspects of aftercare,
Yeah.
but I think it's important to kind of bring it back to that bigger picture
Okay.
of what we're really talking about here,
Yeah.
which is recovery
Recovery.
and what it actually means to recover from opioid addiction.
Right, because recovery is not just about abstaining from opioids.
Right, it's about so much more than that.
It's about so much more than that.
It's about
It's about rebuilding your life.
building your life.
Yeah.
It's about
It's about healing
healing
on a deep level.
on a deep level,
Mm.
mentally, emotionally, physically,
Mind, body, and spirit.
mind, body, and spirit.
Exactly.
And it's a journey.
It's a journey. It's not a destination.
It's not a destination.
Right.
So you're never really done.
You're never really done.
You're always working on it.
You're always a work in progress,
Right.
but that's okay.
It's okay.
It's okay to not be perfect.
It's okay to not be perfect.
It's okay to stumble.
It's okay to ask for help.
Ask for help. Absolutely.
Because you don't have to do this alone.
you don't have to do this alone.
There are people who care.
There are people who care.
And there are people who want to help.
Absolutely.
So if you're listening to this
Yeah.
and you're struggling,
Yeah.
please reach out.
Reach out for help.
There is help available.
There is help available.
And you don't have to do this alone.
You don't have to do this alone.
And recovery is possible.
Recovery is absolutely possible.
It really does feel like climbing a mountain, like you said.
It is. It is.
You've made it to the top.
You've reached the summit.
You've conquered that initial climb.
Right.
But now you've got to figure out how to get back down.
And that can be almost as challenging
Right.
as the initial climb itself.
Yeah.
Because you're tired.
Yeah.
You're probably you've been through a lot.
You're probably running on fumes at this point.
Exactly. Exactly. And so it's easy to kind of let your guard down
Right.
and think, okay, well, I've done the hard part.
Right.
Now I can just coast. But that's not the case at all.
Right.
You really have to kind of keep your foot on the gas
Mm-hmm.
and keep working at it.
So what are some things that people can do to kind of prepare for that descent?
Well, I think one of the most important things is to have a plan.
Okay.
Just like you wouldn't climb a mountain without a plan.
Right.
You don't want to go into recovery without a plan either.
Okay. So what does that plan look like?
Well, it's going to look different for everyone.
Okay.
Because, again, everyone's needs are different.
Right.
But there are some key elements that should be in place.
Okay.
And one of the most important ones is support.
Okay. So we're back to that support system
We're back to that support system.
that we talked about earlier.
Exactly. Because, as we've discussed, recovery is not a solo sport.
Right.
You need people in your corner.
You need a team.
You need a team. Exactly.
So that could be friends, family members,
Mhm.
a therapist, a support group, anyone who can offer that
That encouragement, that accountability.
accountability. Yeah.
Yeah, because, it's hard to stay on track
Mm-hmm.
when you're doing it alone.
Right.
But when you've got people who are there for you,
Yeah.
who are rooting for you,
Mm-hmm.
it makes a world of difference.
It makes it easier.
It does. It makes it easier. It makes it more manageable.
And it makes it more likely that you're going to succeed.
Exactly. Exactly.
So we've got support.
Mm.
What else? What else goes into that plan?
Well, I think it's also really important to have healthy coping mechanisms in place.
Okay, so we talked about this a little bit earlier, but this is where things like mindfulness, exercise,
Oh, absolutely.
journaling, all of those things
All of those things can be incredibly helpful.
come into play.
Because, as we've discussed, recovery is not about being perfect.
Right.
It's about learning how to manage
Right.
those difficult emotions, those cravings, those urges.
And having healthy ways to cope with them.
Exactly.
Ah.
Exactly. So that you don't have to turn to opioids.
So that you don't relapse.
Exactly.
Okay, that makes sense.
Yeah.
So you're coming down the mountain.
You're coming down the mountain.
You've got your support system. You've got your coping mechanisms. What else do you need?
I think the last thing I'll say is that it's really important to be patient
Go.
because recovery is a process.
It's a marathon, not a sprint.
Exactly. Exactly. And it's going to take time. It's going to take work.
Yeah.
And it's not always going to be easy.
Right.
But it is so worth it.
It is worth it.
It is so worth it.
And that's what we really want people to take away from this.
Absolutely.
Is that, if you're struggling with opioid addiction,
Yeah.
you're not alone.
You're not alone.
There is help available.
There is help available.
And recovery is possible.
Recovery is absolutely possible.
It is possible to reclaim your life
Yes.
and to live a happy
And fulfilling.
and fulfilling life free from addiction.
Absolutely.
And to our listeners, we hope that this deep dive has given you a better understanding of not just the complexities of opioid detox, but also the long road to recovery that follows.
It's a journey, but it's a journey worth taking.
It is. And that's all the time we have for today. Thanks for joining us, and we'll see you next time.